Good afternoon. And today we have a pleasure of having a conversation with Dr. Priya Mistry, someone who I try to convince to come to our channel for a long time, but she's very busy because she's not only the excellent doctor who helped people with temporomandibular joint issues, she is also really popular influencer on the TikTok and Instagram. So today we find out all the secrets of her trade. Good afternoon, doctor.
Good afternoon. Thank you for having me.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this interview will be very well for you, because a lot of people who suffer from sleep and breathing disorder, they also suffer with temporomandibular joint issue. It's such a connection. And if you're a medical professional who, just like I mean me and Dr. Priya, find all the puzzles of sleep and breathing disorders and put them together, what we have opportunity to treat our patients in the most efficient way, this interview would be for you, because we're going to uncover the connection between jaw joint and fascia and pelvis and a lot of pain in the head and neck and way to treat those disorders. So let me start with my story with Dr. Mistry. I heard the legends were coming to my ears about her influential videos on Instagram. And of course, I joined the followers and I really enjoy them. I find what the way she presents the education in a very engagement, humorous, fun way, I think that would have a best effect to the listeners. And also, in the same time, this particular approach gonna paint the portrait of the dentist as a stylish, fashionable, kind, and knowledgeable in the same time. That's what we all try to do, to make people actually have a desire or will to visit the dentist, because that's going to be fun and also it's going to make them feel better. So a little bit about Dr. Priya. She graduated from the University of Pacific, and I guess was lucky opportunity. She came across of her mentor who was treating TMJ for many years, and she found this area really interesting. And she didn't stop her education at that point. She's just like me, diplomat of American Academy of Dental Sleep Medicine, because she find temporomandibular joint disorders and sleep disorders are very much related. And then, just like I mentioned before, she become really popular influencers on TikTok and Instagram and YouTube, what she increased awareness among the patients and providers about temporomandibular joint disorders and how to treat them and how they relate to other parts of the body. And she does a lot of courses and webinars, and I highly recommend you to follow her videos. They're not only gonna make you more knowledgeable, but also they're gonna make you smile.
Yeah.
So my first question to you, Dr. Mistry, please tell us, what exactly inspired you to choose that path?
Yeah, so I had been practicing general dentistry for 11 years before I met my mentor, Dr. Arthur Parker. And I sort of met him on a whim, and him and I started observing him and shadowing him. And on the first day that I went to observe him, so many patients said he helped me, he changed my life. I was in so much pain. One patient even told me they were ready to kill themselves. They were in so much pain. And Dr. Parker's treatment got them completely pain free. It got them their life back, right? And so I thought, gosh, what is he doing that we didn't learn in dental school? So I told him that day, I said, I want to buy your practice. I want to work with you, everything. I want to learn what you're doing. And, the rest is history. I started working with him, and it really opened up my eyes to so much that was left out of our training, because it's not common knowledge. And so I love the school I went to. University of the Pacific was a great dental school, but there's just not much in terms of treating TMJ problems or pain.
No, I agree with you. I went through NYU and I have the same impression. But I want to ask, we're going to talk about treatment a lot today, but I want to ask you about your social media influence. how it's significant part of your um, practice, I would say, your work. Please share with us, what inspired you to do that, and what are the secrets of this, ladder, because a lot of us trying to climb the ladder to be closer to our patients or to our audience. Tell us your secrets.
Yeah. So I was sort of inspired to make my YouTube channel. That's where it all started back in 2020 because my mentor wanted us all to come up with a way to stay relevant, stay afloat during the pandemic. And we all had different ideas. And I said, I'm going to start a YouTube channel. And he was pretty skeptical. And I was even skeptical, but I didn't have any other ideas. So I started it mainly to put information out there because the one thing I saw happening again and again and again is patients would come in and they would say, why didn't anybody tell me that I had like that this was a problem? Why didn't my dentist tell me? Why isn't there information out there? Why? So I said, I'll just start making information. So that's what inspired me. I started that in 2020 and it's grown substantially since. And then in terms of just like everything else, like Instagram, I started a few months later. TikTok, I started a few years later, or a year later or so. But basically, with my all my social media, I think that there's 5 things that you can do to really make it stand out to people and have them listen. And the first is make it fun. Don't be boring. Nobody wants to listen to boring. As soon as they see boring, they swipe away. So make it fun. And I like to speak how I normally speak. I like to dress how I normally dress. I like to just give people an insight into my real life. So it doesn't have to be so perfect and professional. I try to keep it fun. So that's number one. Number two is add value. Think about what your audience would want to know. Not so much about what you want to say, but what they would want to know and how to deliver that again in a fun way. Um, Number three is use trends. Watch TikTok, watch Instagram, and that can be like 10 minutes a day. You can find so many trends. There's even influencers out there, their whole thing is talking about trends. And so just follow them and they'll tell you what trends are trending. And then four is definitely use hashtags, spend some time on your captions using those keywords. You can look up all those words I just said if you have no idea what I'm talking about, but that really helps engagement. And then five, shoot in bulk. Shoot a bunch of small videos in one day, and then that'll stockpile you for a while. So you don't feel overwhelmed or stressed to film every single day. So I think those are like the 5 main things that have really helped me. I always shoot in bulk. I shoot a bunch of things at once. And so, I mean, setting up the lights, setting up the tripod, all of that takes time. So if you can just do it once and shoot a bunch of videos, then you can take it all down and do it again like 2 weeks later.
No, I think all great and delivered in a concise method, just like your channel. I love to watch that. So now I want to become very serious about the treatment. And a lot of people watching your video, or even medical professionals, are very surprised. What's the connection between the jaw and the pelvis? They actually located quite far.
Mhm.
And but as a practitioner or observer of my patients, I usually ask them, what else hurting you? You have pain here. A lot of people said my neck, my shoulders. That's very common. And some people said to me, you know what? I'm gonna have my knee replaced like next week. Or I just had in a very young age, had my hip replaced in age 40. And I'm wondering, oh, and I see it quite often. Please tell us, what do you think the connection is there? Or is just the accident?
No, there's definitely a connection. So, some practitioners are very aware of this connection, especially physical therapists. So, the jaw and the hips, those are 2 components of our entire posture. So, the other components, so if you look at all the components, there's the jaw, there's the shoulders, the entire spine, the hips, and our feet. One component can have an effect on another component. And so specifically the jaw and the hip are connected, one by our dural tube running down our spine and by fascia. Fascia is thin connective tissue that surrounds all our organs, all our muscles. And when we were in dental school and we did our dissections on cadavers, we would just push the fascia aside like, get out of my way. I'm trying to get to the muscle. I'm trying to get to the organ. But the fascia is super important. And that's what I've come to realize, because fascia can hold a lot of tension. And so imagine fascia as like a bodysuit, a stretchy bodysuit that you're wearing over your head, over your whole body. If you just knot up one part of that bodysuit in one area, right, it's going to pull on the whole bodysuit and have a ripple effect and cause issues elsewhere. So same thing. It's like people who have very type A personalities. I'm a type A. We hold a lot of tension in our jaw and our neck and our shoulders, but that can feed down through fascia, through the dural tube. It can feed down and affect the pelvis and pelvic floor. If we hold a lot of tension in our jaw, most of those people hold a lot of tension in their pelvic floor too. And so there's definitely a connection there. And I always assess people's postures. Sometimes I assess the way they walk, because a gait where you're favoring one side can really feed up all those postural components, the postural chain, if you will, and affect the jaw.
No, that's a very, very comprehensive answer, I would say. But my explanation to people, a lot of people ask me, why am I clenching?
Yeah.
And I usually answer them, that's your way to find your balance.
Yes.
It might be emotional balance or
Yes.
physical balance.
That's a
but
good way to answer.
Give me your thoughts on
Yeah.
that.
Yeah. Yeah, totally. So I think, the number one reason for nighttime clenching and grinding, I think, is sleep disordered breathing, like some sort of sleep apnea or mild or some sort of upper airway resistance syndrome, right? But clenching during the day, that's different. I think people clench all day either because of stress or what you just said, balance. It's a way to find stability. When you're clenching with your upper teeth and your lower teeth, the lower teeth, the postural component that's involved there is the jaw. The upper teeth, the postural component that's involved there is the neck and therefore the shoulders. So that's a way of bringing stability to the jaw and the shoulders and part of the spine, the upper spine. So people that have imbalances in that postural chain, many of them clench all day because at least it brings stability here. So yeah, I totally agree. I think balance is a great way to say that. I've always
Thank
said
you.
stability. Yeah, I think that's great.
No, because what I found, practicing for very long time, I always observe my patient's mouth, and I never saw that huge thoraces underneath
Mhm,
the tongue in the
mhm,
area of premolars. We call it
mhm,
buttresses or tori, whatever you call, as
mhm.
I see now. It's like a little tables. I can serve tea there.
Yeah.
And I
Oh,
never saw the size of that. No, like seriously.
I just
I
saw
mean,
some yesterday. That's why I'm laughing.
no, they can look like bubbles. They can have a different shapes. Like it
Sure.
depends, I guess, on a pattern of clenching.
Yeah.
But I observe what it's so much more. Just like during COVID time, I've observed a lot of vertical fractures or horizontal, what I never see in the regular days.
Right.
Like we react. That's why I use the word balance, because people were trying to find the balance with the teeth. It was so unstable, like end of the world kind of a situation. So they
Mhm.
they did that. But I would like to ask you also about people who suffer with the temporomandibular joint disorder. How bite, the way teeth are aligned, impact this area.
Yeah. Yeah. So there are some common bite patterns, the way the teeth come together, that I see with my patients with TMJ problems. So one of them, let's start with a deep bite. So what does deep bite mean? When you look at your front teeth from the side, we want to see them come together like this. A deep bite is when they come together like this, right? And so what happens with a deep bite is that these top front teeth overlap the bottom front teeth too much. And with that deep bite, what happens is every time the teeth come together, the lower teeth are held back by the upper teeth. And so that means the whole jaw is held too far back from ideal. When the jaw is held too far back from ideal, the little disc of cartilage inside the jaw joint can more easily become displaced or dislocated too far forward. That can lead to clicking, popping, or the jaw can even lock closed. Super painful. You can barely open more than one finger with. So that's one bite pattern. The second is an overjet, where the um, top front teeth go too far out. And when the teeth come together, again, it holds the jaw too far back. So, same thing with a deep bite. It can lead to clicking, popping, or the jaw locking. And both of those bites will actually make the muscles mad too. The jaw has an arc of closure where the muscles and the joints are most comfortable. But sometimes the way the teeth come together is not that same position. So that makes the muscles start to compensate and compensate and compensate until they can no longer compensate, and then the pain sets in. Another one that I see commonly is a crossbite. So our teeth should
Oh.
fit together, yeah, like a hat box,
Hmm.
with the upper teeth going kind of overlapping the lower teeth. A crossbite is when the opposite is happening. In the front, in the back, all around, doesn't matter. What happens with a crossbite is when the teeth come together, it puts too much lateral strain, sideways pressure on the jaw joints. And they don't like that either. So the muscles compensate. It can lead to clicking, popping, it can lead to pain, etc. So those are probably the three most common bite patterns I see. And two other ones that are close follow ups are a class 3 bite, like an underbite, like that, where the bottom teeth are in front. Muscles don't like that either. So typically, those people don't have clicking, popping, but they have a lot of pain. And then open bite in the front, where the back teeth come together, but the front teeth are open. It's just too much pressure on the back teeth. The bite force is not balanced at all. The back teeth are doing all the work, makes the muscles mad, leads to problems and pain.
I really like that. Make muscles mad. Well, we don't want to make those muscles
We don't
mad.
want to make those
No.
muscles mad.
So please tell me, what's your strategy for treatment?
Yeah, so most of my patients, I use orthotics. So I use TMJ orthotics, which is very different from a night guard. All a night guard does is protect your teeth, which is important. We don't want them to break. But night guards do not treat your muscles or your joints. That's what I do. I have technology and software that measures where the muscles are most relaxed. It's a very specific position called the correct resting length, and where the joints are decompressed. And then we build a daytime and nighttime orthotic to guide the jaw to that specific position. And when the muscles are held at their correct resting length, their most relaxed position, their happy place for a significant amount of time, good things tend to happen. We typically see pain go down pretty drastically within a month, month and a half. Clicking, popping, locking. I cannot always make a single click or pop go away. I just can't. It's usually the ligaments are too loose. It doesn't always reduce completely, but we can prevent that click or pop from progressing to jaw locking closed, which is super painful. And if the jaw is already locked closed, um, I throw in a lot of manual therapy. So with muscle releases, with a very specific type of manipulation, gentle stretching and manipulation of the jaw, we can help our patients to become unlocked so that they can open more, the pain goes down, etc. So I do orthotic therapy, I do a lot of manual work, craniosacral therapy, myofascial release, jaw manipulation, and then I just got trained by the amazing Dr. Ben Sutter in using the T scan, which really measures relative bite force, and then you do minor micro adjustments on the teeth, removing microns of enamel. So a micron, there's 1,000 microns in a millimeter. So it's really small amounts to balance the bite force, which will also calm the muscles down. So those are the methods I use most commonly.
I have a question for you. Once you done that, and supposedly patient wearing orthotic 24/7, we hope. What happened after that? You restored the teeth in that most comfortable position. Is that right?
No, so a lot of my patients, we try to minimize the chance of the bite changing through treatment. So a lot of neuromuscular dentists will give you an orthotic that you cement onto your teeth or
Mm-hmm.
that you wear 24/7, you never take it out.
Mm-hmm.
And they tell you in advance, like once you start wearing this, when we take it out 3 or 4 months later, when all your pain is gone, all your symptoms are gone, we're going to take it out, but your teeth are not going to fit together. And they'll tell you that. You know this going in. So this is not a trick or a surprise. And then you're left with the decision of, do I get braces or do I do crowns on all my teeth, full mouth reconstruction, to bring the bite back together? So that's how it's traditionally done. The way my mentor always did it is he made a daytime and a nighttime orthotic, both of which you can remove. And he
Mhm.
always asks, and I always ask my patients to take the daytime one out when you eat because it'll reset your bite. It'll lower the chance of your bite changing because many adults do not want to go through braces again. Many adults do not want full mouth reconstruction or cannot afford full mouth reconstruction. So we just try to minimize changing the bite. So are you getting a perfect solution? It's hard to say because my patients have to wear their nighttime orthotic forever. So that's the price you pay for not doing the full mouth reconstruction or the braces. So my patients don't typically need a phase two, but they have to wear their nighttime orthotic forever. So if the dog eats it, if you lose it, if you break it, you have to get another one. So
Yeah.
that's the trade-off. It's kind of hard, and many people are very attached to their bite. Is this going to change my bite? Is this going to change my bite?
Ye-
And I totally get it. Like I don't want braces either, but we have to all understand that the bite might be what got you here in the first place.
Exactly.
Yeah.
Exactly. No, I understand. My point is, um, that's the question. You don't do phase two. I actually do phase two,
Oh, good.
and I put the patient in that comfortable bite, and they in the
Yeah,
six
yeah.
months in a comfortable bite.
Yeah.
And what I notice, yes, they don't destroy my restoration in the same way as they destroy the teeth, but I was hoping that it's
Yeah.
going to be no emergency, no breakage, but it does happen on some favorite areas.
Yeah. Yeah.
So I guess no solution is perfect.
No
But
solution is perfect. Exactly.
yeah, that's thank you very much. I really appreciate you have such a vast amount of information what your audience and my audience can learn from, and
Yeah.
I recommend everyone to watch your videos.
Thank
This
you.
60 seconds a day gonna really increase your level of knowledge and relief in this area. So thank you very much, and we hope to see you back
Yeah.
with
Thank
more
you.
tricks and tips how to make not only pain-free life, but maybe also better appearance with the different tricks what you preached
Yeah.
on your channel.
Yeah, definitely. Thank you so much for having me. This was really fun.